let me just talk a little bit briefly about perhaps the combination of Radium-223 with other novel agents, specifically Radium-223 plus Abi, Radium-223 plus enzalutamide, and Radium-223 plus sipuleucel-T. So there is a series of trials that some have been completed, some have not, some have been fully presented, and some are not. The bottom line is, with Abi specifically, the question oftentimes is, how do you layer Abi with Radium-223, or did you start together, you know? So the most important piece of data, in my opinion, is the ERA-223 data, which is the data that actually randomized men with metastatic castration-resistant disease to the combination of Radium and Abi, or Abi and placebo. And clearly that data did demonstrate that there was a significant increase in the skeletal-related or skeletal symptomatic or related events. Remember, the difference between SSE, which is a skeletal symptomatic event, is that it's driven by a symptom, not by a film. Whereas SRE usually tend to be dictated by radiographic findings that lead to a symptom, if you will, but they're exactly the same. Spinal cord compression, need for radiation therapy, orthopedic surgery for pathological fractures, and spinal cord compression. So when you look into that, I think the important part of this is twofold. With that data, I actually refrain of using the combination of Radium-223 and Abi. But I also think there is a misperception on that data, and that data has been taken out of context. Some people have assumed that because Radium-223 was actually used earlier, it would imply that Radium-223 is not a treatment to be used earlier in the metastatic castration-resistant prostate cancer setting, which is not what the trial tested. The trial was intended to test the combination of both agents, right, against one agent alone, and that's what we saw. There is published data actually in the last year or two of ASCO meetings, looking at enzalutamide, and although less, SRE events were noted with enza, trials cannot be compared head to head, but that also would imply maybe that the importance of bone health agents. Which brings me to a very important point. I don't use radium in combination with oral therapy at present time. And I'm intrigued to see what is the final result of some of the data with Radium-223 and sipuleucel-T. That's a fascinating combination, in my opinion, that hopefully will actually lead to some benefit to most men, and hopefully we're going to be able to utilize it in the future. Obviously, we're going to have to wait for that data to come out.